Stroke is the leading cause of death and serious long-term disability in the United States.
The most common type of stroke is the ischemic stroke, which is typically you have a clot or a plaque that's in your neck's arteries will break off and go to the head, and then it'll block a small artery. At that stage, the brain starts being starved for blood supply, and then brain cells start to die. The other type is a hemorrhagic stroke, and that occurs in about 13%, and that's when there's a bleed in the brain. A little vessel actually starts oozing and bleeding.
Do you know the signs and symptoms of stroke?
You'll notice maybe problems with your speech, problems finding words. They may have facial drooping. Sometimes one side of their body will be weak, like they'll have weakness in their arm, or they'll be dragging a leg or something when they walk. Those are the common things you should look for.
If you suspect a stroke, Dr. Parker wants us to remember the word FAST.
F-A-S-T. FAST means just look at their face, ask them to smile. If you notice the symmetry's normal, that's a good thing. If you notice one side doesn't work, that's a problem. You can ask them to hold their arms up. If you see one arm drifts or can't be held equal with the other, then that may indicate a problem. You can ask them to speak to you. Repeat some sentence that you give them.
Time is crucial in the treatment of stroke.
Time is brain is the saying that the public is hearing about nowadays. And basically what that means is once you have evidence of a stroke going on, time becomes a factor and a critical issue, because brain cells may be actually dying and being knocked off, so you want to address it as quickly as you can.
Treatment may be available if you get to the emergency room immediately.
Our stroke center has been accredited and evaluated, and in fact we're one of the top 100 hospitals in the nation for stroke care, and we're very proud of that. Here we have an Ochsner affiliation where our patients are rapidly seen by an Ochsner neurologist, and decisions are made about whether TPA is appropriate. That's the clot buster drugs that people hear about, or other types of intervention may be necessary. And they make those decisions, and we move forward based on that.
Stroke strikes fast. You should too. For more information, call Christus Cabrini Hospital, 866-581-3627.
The Medical Minute is brought to you in part by Christus St. Francis Cabrini Hospital.